Most people experience a skipped beat or a sudden flutter in their chest at some point. It can feel like your heart did a somersault, paused for a split second, or gave an unusually strong thump. In the vast majority of cases, these occasional palpitations are completely harmless, often triggered by stress, caffeine, lack of sleep, or even dehydration. They are brief, pass on their own, and leave no lasting effect. The key to understanding palpitations lies in their context, not just their presence. A single, isolated extra beat that happens once a day and is otherwise unaccompanied is typically nothing to lose sleep over. If you can connect them to a specific lifestyle factor like a heavy meal, anxiety, or a particular beverage, that correlation is another strong sign they are benign. Your heart is simply reacting to a temporary stimulus. However, the picture changes dramatically when palpitations are not an isolated event but part of a constellation of more serious symptoms. If the fluttering in your chest is accompanied by dizziness that makes you feel unsteady, or if it feels like the room is spinning, this is a clear warning sign. This suggests that your heart's abnormal rhythm is affecting blood flow to your brain, which is never a benign event. Chest pain or pressure that occurs alongside palpitations is an immediate red flag. This discomfort can feel like tightness, squeezing, or a heavy weight on your chest, and it should never be ignored. This combination can indicate that your heart muscle is not receiving enough oxygen, which requires urgent assessment. Do not wait to see if it passes. This is the time to seek help without delay. Shortness of breath, especially if it occurs at rest or with minimal exertion, is another critical symptom to pair with palpitations. If you feel like you cannot catch your breath, or if you are gasping for air while doing nothing strenuous, your heart may be struggling to pump efficiently. This is a sign of hemodynamic instability, meaning your body isn't getting the circulation it needs to function. Beyond these specific symptoms, there are other criteria that elevate the concern. If you have a known history of heart disease, heart failure, or prior heart attacks, any new or worsening palpitations should be evaluated promptly. Similarly, if you have a family history of sudden cardiac death or inherited arrhythmias, your threshold for seeking medical advice should be much lower, as your risk profile is different. Another critical factor is the duration and pattern of the palpitations. If they last for more than 30 seconds, if they come in runs that stop and start abruptly, or if they feel very fast and irregular like a bag of worms in your chest, these are more concerning than a single skip. You should also seek help if you faint or nearly faint during an episode, as this is a definite sign of a serious rhythm disturbance. Ultimately, the rule is simple: benign palpitations are a nuisance, but dangerous ones are a warning. The presence of any associated symptom like dizziness, chest pain, or breathlessness is your body's alarm system. When that alarm sounds, do not hesitate. Call for emergency services or go to the nearest emergency department. Your safety is worth more than the discomfort of a trip to the hospital, and getting a proper evaluation is the only way to know for sure.